Stubbs, and she's a medical missionary and also the CEO of Sleep and Total Wellness Institute. She also holds the Health Committee Chair position for the Henrico NAACP.
And I specialize in sleep disorders. So what I'm going to talk to you about today is sleep, how it affects your health, and then let you know that everything that has already been talked about, and probably the things that will be talked about, impact sleep. So if you try to define sleep, it would be very difficult to do that because you have what you see, the person who appears to not be aware of the consciousness, but on the physiological side, the person is actually not unaware of what's happening. So let's just say we all know what sleep is. Then we'll go into why we sleep. We don't really know all of why we are sleeping. We just know that you have to sleep. So if a person says that I haven't slept in all week, we know that that person is not giving an accurate history because it's impossible to go without sleep. If you look at animal models, if the animal is kept awake for about 3 days, they start to develop health problems. Within about 2 weeks, the animal will die. So we know that you have to have sleep. We know that it impacts your health. We know that sleep is important. Some years ago, not too long ago, a researcher did some research out in California looking at sleep deprivation, and if we don't sleep enough hours, how does that impact the person's sleep? What that researcher found was that the people who didn't get adequate amounts of sleep tend to have more chronic illnesses, and they tend to die. Initially, that research was not accepted. It just seemed so far-fetched that sleep or lack of sleep could cause a person to die or to have chronic illnesses. But if you fast forward to today, we know that sleep deprivation affects almost every body system that you have. For example, if you don't get enough sleep, they now have found that it affects your memory, but also may be a factor in development of Alzheimer's. When we go to sleep, the brain cells shrink down, and we think that during that process, chemicals come out of the brain and are washed away. And if you do not have an opportunity to clean out this, what we call just the byproducts of metabolism, they stay within your brain and they give you health problems. Lack of sleep disturbs your hormones or neuropeptides that control your appetite and what you crave. So people who are sleep deprived have an increased incidence of being above their ideal body weight. We know that sleep deprivation will affect your blood sugar, and it can cause people to have unstable blood sugars and contribute to diabetes. Hypertension alone is now considered to be a marker for a sleep apnea. We know that sleep deprivation from the nurses study, those nurses work night shift. We know that they had an increased incidence of GI problems. We also know that if you do not get enough sleep, there's an increased incidence of hormone-sensitive cancers. That would be breast cancer and prostate cancer. So we talked about some medical conditions, and the reason I'm bringing those up is because within the African American community, followed by other minorities, all of those incidents of diseases are higher. And we are now beginning to question if it's higher because the quality of sleep among minorities, especially African Americans, is different regardless of income and regardless of your professional status. So we know that people who have a low income level have a higher incidence of short sleep, inability to sleep. But we're also finding that professionals have a lot of stress compared to their counterparts who are not black in the same position, and they get less sleep. When you look at the economics, how does that affect the community? We know that people who do not sleep well do not get the same promotions that other people do. They don't learn as well. They're not as friendly or social or interactive as their counterparts who are getting a good sleep. So they tend to have a lower income. They've missed their promotions. They don't get to excel in their careers. We know that academically, children who do not get enough sleep do not perform as well as those who do, and they tend to have behavioral problems. So these are some of the complications of short sleep or sleep deprivation. What I've done for you is I've modified the brochure that we give out at our practice and health fairs to give you a little information on the back, tips for healthy sleep. I've given you a handout that tells you the suggested hours that we should sleep across our different ages. I also, on some of the brochures, I added a little picture of an infant sleeping on the back, because infants need to sleep on their back. Within our community, we are still not putting our children on their backs, the infants. So they have a higher rate of sudden infant death syndrome among African American babies. We have not benefited from the Back to Sleep program like other ethnic groups. I've given you a block with 9 suggestions on what we call sleep hygiene. These are tips that will help you to sleep better. And I also have given you the blog, the web address for our blog, which will tell you some tips on not just sleeping, but health in general. And right now we're looking at the effects of arthritis. We use food and an integrative approach to our health, so to our health plans. So our practice is located in a physician shortage area. The practice is a ministry, and our goal is to provide health care to the wealthy and the poor in the spirit of Christ, who serve the wealthy and poor. And our vision is access to health care for all people. So I hope that's given you some idea about the importance of sleep, what happens when we don't get enough sleep, and that sleep is impacted by everything we've already talked about, and I believe everything that's to come.
Your director with Tricycle Gardens. And although we've heard a bit about food, we'll hear some more from Mr. Williams.
Thank you, thanks. I just heard that title today, so somebody's jazzing up my life story, which is always a good thing. So I used to be the project manager at Tricycle Garden as well. I passed out the sheet with a few of our programs that address the food insecurity that we have in Richmond. We looked at some of the health department's graphs, and we discussed food insecurity and community gardens earlier. Richmond, per capita, has more food deserts than any other city in the United States. And that deals, of course, with economic inequality, a history of racial prejudice, and, of course, the poor structuring of our urban core. No public transportation, for instance, low access to jobs, and terrible health for those who live here. So instead of discussing the individual programs that we have, I'll let you all read that. It's homework. You all love homework. I'm going to discuss an issue that I've been working with over the past year, or a couple of projects that I've been managing. The first of which deals with food waste. Food waste I see as the bridge between food insecurity and environmental degradation. I'm going to throw out a few numbers. It's 40, 30, 20. So those numbers have very important meanings behind them. 40 is 40%. 40% of all food produced in the United States is wasted. That's food that could go to food insecure neighborhoods. In fact, it's just a supposition or an idea that I have, but you probably have enough food in Richmond to put grocery stores in all of the insecure neighborhoods. 30% of all this food goes to landfills, and food comprises 30% of volume at landfills. That means that a third of everything in a landfill, which is closer to neighborhoods of low income or minority neighborhoods, is food waste that should have been eaten. And then 20%, and this is the sort of environmental component, and 20% of our methane is produced from landfills. So in reducing our food waste, we'll reduce our pollution in the air. And methane, of course, we know, is a very potent, more potent than carbon dioxide, it's a potent natural gas. It's also a very powerful and useful natural gas if we harness it, but I'll get to that later. So I've been working to go to a few area restaurants and pick up food waste and bring it back, compost it, and then put it onto our soils in our urban farm. It's not enough. We need better solutions. For instance, we need a municipal food waste pickup, which would add jobs to our city. It would allow us to compost and supply community gardens and urban farms. We also need a sort of radical redistribution of our food waste, or food that's still viable, that's still edible. That means we need to take food that's in Carytown and bring it to the East End, South Side, North Side, or what have you. There's no reason for people to go hungry if there's already food. There's no reason really to rethink the wheel if we're producing enough. Just as another fact, we know that Americans are very wasteful. French people waste about 200 pounds of food a year. Americans waste 600 pounds a year per person, so that's 3 times as much food waste. Of course, they have progressive legislation that is making it illegal to waste food that is edible. Other cities have really great models that we should follow in Richmond and other cities in the South. Seattle, Portland, DC, New York all have food waste pickup and have very innovative food recycling programs as well. So that means our charitable organizations and our municipalities need to connect. That also means that we should start to think about alternative energy, such as anaerobic digesting. All of our homes in our communities could receive electricity from food waste. If we build anaerobic digesters and use the methane produced within those facilities as electricity or a resource to power our homes, power our heating, and make it a little bit better to live in the South. So that is one project that I've been thinking about: food waste collection, food waste recycling, food waste or food distribution, redistribution. Very important. The next thing I want to discuss is healthy soil. Healthy soil is the foundation to healthy food, which is the foundation to healthy people and healthy communities. Recently, working on 31st Street Baptist Church, which is the first USDA-approved urban farm in the nation, and it's here in Richmond, we've come into contact with lead-contaminated soil. And we know from the history of the automobile that we've spewed lead onto our streets. We know from the history of paint that we've painted it onto our houses. We've put it in close proximity to very young people whose neurological systems can be damaged. So whenever we're going in and thinking about turning our empty lots into community gardens, we need to make sure that we do our soil tests. Even if it's not a community garden, if it's your backyard, you need to be sure to test your soil for heavy metals and arsenic. And if you want to ask, I've got a few local suggestions to send your tests to. So, healthy soil is very important. It takes years to cultivate healthy soil. It's the basis of our ecosystems and environments, and we need to make sure that if we push for community gardens and urban farms, we have solutions. We have access to grants to the EPA, who will help us remediate the soils. The last thing I want to talk about, because it's what, 1 more minute.
Yeah, almost.
The last thing I wanted to talk about was designing beautiful spaces, or the disparity in aesthetics that exists in urban cores. So we're talking about corridors such as Monument Avenue being very beautiful, well-maintained, and very attractive for residents, unless you're me and despise some of the statues there. In the East End, however, we have the lack of that sort of maintenance. And so we not only need the design and implementation of beautiful spaces, but the constant maintenance of these places. And that, again, would supply jobs to our community. So these are some of the things we've been thinking about at Tricycle Gardens. I think my time is up. Thank you.